Hi there, my name is Dr. Andre Aboolian. I have Barbara on my right side, and I have Amy on my left side. Amy just had body lift 3 weeks ago with liposectioning, and Barbara on my right has had a body lift with liposectioning. She's had her arms done, and she's had her sides, the size of the breast done. I'm going to let both of them say a couple of words about their experiences and how they went about losing their weight and how they came to be plastic surgery patients.
Okay, I originally had a gastric stapling 18 years ago that was very unsuccessful, and over the last, about 3 years ago, developed an incisional hernia, and that sort of motivated me to take care of the hernia and also maybe investigate bariatric surgery at the same time, and came upon a surgeon that was able to do a gastric bypass on me. And going to their support groups, Dr. Aboolian spoke one time, and he said he does his vertical incision and pulls, and I said to my husband when he was sitting there with me at the group, "That's for me," I said, because I had this terrible keloid scar in the middle, and his procedure sounded just perfectly fit for me, and I went ahead and did it. And then like 3 weeks later, did my arms. I had lost 90 pounds, and when I went to see Dr. Aboolian, I said, I'm coming to see you to find out how much more I need to lose before you would consider doing me. And he said, "You're fine as it is. It's not going to make a big difference if you lose another 10 pounds, and I can do you now."
What we recommended for Barbara is, instead of torturing herself and losing another 10 or 20 pounds, I told her that we can remove that skin and she'll be at the weight she likes to be. But to me, the more important thing with all bariatric patients is that they have essentially done away with their bad habits, which is clean up their eating habit, have some sort of an exercise routine or regimen that they follow so that they're healthier, their heart is healthy. And I want at least a year to pass from their bypass surgery, whether it's gastric bypass or lap band surgery, or if they've done it completely on their own without any surgery. And after surgery, she can tell you how happy and how her recovery went.
I'm going to tell you how happy my husband is too. He's very supportive, and he has been with me the whole way, and I'm very lucky that I have such a strong support system. My first surgery on January the 10th, which was a body lift, and I had my arms done on February 2nd because I figured if I was down for the one, I might as well be down for the second one, and then we were off to China and Tibet on April 15th. So it was a pretty rapid recovery.
What I tell patients is to give me 2 weeks for their recovery, meaning they get their surgery done, they're out of bed within 48 hours, up and walking. I want them to stay put for a good 2 weeks, meaning I want them walking around, moving around, but I don't want them to do much. And if they have a desk job, they can go back to their work within 2 weeks. As far as pain is concerned, which is the thing that everybody is concerned about, I tell them it doesn't really hurt. And Barbara may have forgotten since her surgery was in January, but Amy here has had her surgery about 2.5, 3 weeks ago, so she can tell you more in detail about how her pain was. But it's a procedure that doesn't really hurt, but what your patients feel is pressure. When they move around, they feel like, there's pressure, and they feel like they're going to pop into two. They feel like their stitches are going to come undone. So I tell them that basically, even after 2 weeks when they go to work, to still take it easy. No exercise, no lifting for a good 4 to 6 weeks. And the recovery is pretty much very easy as far as from what I see with the patients going through. The major thing that they all experience is, when am I going to exercise, when am I going to move? And their biggest fear is, am I going to gain my weight if I'm just laying around doing not much? And I tell them, no, it's not going to happen. And Amy's going to tell her side of the story and how far she is from her surgery.
Yes, I lost weight through diet and exercise, and I was up to a weight of 260 pounds. And my weight has yo-yoed up and down since I was a teenager, so probably one too many times up and down of like 70 pounds at least, and the skin just wouldn't recover. And I had got down to my goal weight last year, and I just could tell that my skin, I was doing a lot of exercise every day, weight training, and it just was not coming back. And so I do watch a lot of the TV programs with the Extreme Makeover and the Biggest Loser, and I got some names of some physicians that I saw, and I looked and I went in for consultations, and I just felt the most comfortable with Dr. Aboolian, and his just attention to detail, and the before and after pictures were just so much superior. So I just had a great comfort level there, and so we decided that the summer was a good time to do it. I had had my weight off for about a year, so I felt like my lifestyle changes were permanent, and I can live with those. So there will be no more yo-yoing back and forth.
How long are you from your surgery?
Almost, 3 weeks. It was 3 weeks yesterday, actually.
And how was the pain?
The pain is minimal. I've been surprised at how little it is. You do feel the pressure around you, but it's not bad. It's not a painful pressure. And it just reminds you how far you've come in your journey.
All of her sutures will come out next week, and she still has a tape on her scar. And I keep that tape on for a good 2 months. Are you taking any painkillers still?
No.
Okay.
I took them for about 3 days, and then I take a Tylenol here and there, and that would be
And that's the experience most patients have. They'll take painkillers maybe 3 to 7 days, and after that they don't even feel it. They need to. So I don't use any pain pumps. I get them up, after surgery they go to what's called an overnight care facility where they stay there 2 days, no more than 3 days. I don't want them to stay there more than 3 days because I want them to get up, move around, and I want them to feel like they're okay. It's not that bad, and that's exactly what happens. After 2 or 3 days they go home, and I see them 1 week, 2 weeks, a month, 2 months, and 6 months after surgery.
I chose Dr. Aboolian because I did consult with about 3 or 4 other doctors, and it just came down to my comfort level. And when he was talking to me, I could tell he, really cared, and he really wanted to know that the weight was off and it wasn't going to come back on again, and he wasn't going to do it just for the sake of doing it. That I had made some permanent changes, which it's important to me as well, and the detail of his pictures, the before and after, the sitting down poses, which I never saw on anybody else's. So it was just, it was a no-brainer. I had to choose him because he was just the best one by far.
When choosing a plastic surgeon, I think the most important thing, in addition to, as a patient, you liking to your physician, is you have to look at before and after. You have to look at photos. If you're looking for results, when you go see a plastic surgeon, you want results. You should not care how nice they are. You should not care about everything else. Those are important, but you're looking for results. And the way you assess how good of a surgeon this person is you're going to work with, or what kind of results you're going to get, is you have to look at before and after photos, and you have to look at many before and after photos. And when you're looking at before and after photos, they have to show you at least 6 views from each patient, standing up, and the pictures have to be from under the breast to all the way to the knee, so you can get a good feel for the whole body. You're not just looking at the tummy from a close-up view. And then they have to show the front, the quarter turn, profile views, back views, sitting views. These are all things that you have to look at in order to get the best sort of assessment, if you will. And after you've looked at the photos, you need to decide if the scars are good. You need to decide if the scars are in the right places, the scars aren't too high, too low, too wide. And also, after that, you need to speak to some patients who have had the surgery done themselves. And what I tell everyone, even when they come to my office, they'll say, "Oh, I know you've done so and so, and I really want to do it." I say, it's good that you have a good referral, but I still want you to talk to patients. And I give them names of people who've had the surgery done months ago, who kind of are completely healed and have forgotten exactly what it was like to go through the surgery, and maybe names of 1 or 2 people who just recently, like Amy, had the surgery, who can tell you more in detail what their recovery is like. So that way they'll get a better understanding of what's ahead of them.